Now, our next speaker is hopefully zooming into us, joining us remotely, and that's Jennifer Martin, who's a physician and clinical pharmacologist from the Hunter and Chair of Clinical Pharmacology at the University of Newcastle. She's also President of the Royal Australian College of Physicians and a member of the Australian Government Climate and Health Expert Advisory Group. So hopefully over to Jennifer.
It's fabulous to be here, and I'm really delighted that the Society is really picking up this area of work. I think we all have a duty here. It was really good to see Tony's reminder that actually we've created most of the damage that we now see in the environment, and we actually have to own it and to ensure that we can deliver healthcare without actually making the environment worse, which is quite a big job. Just on that first slide, I wanted to note a couple of things. Firstly, we talked a bit about nature, and I think, Tony, you raised also that we've got to look after nature, because if we don't look after nature, it will make us sick. And certainly there's a lot of things that we're doing in health that are actually polluting the environment and really having a significant impact on nature. And we know that if we don't look after nature, our rivers are not clean, we can't fish, we can't eat, we can't grow food. We don't have bees and moths, and for any of you that can remember, 30, 40 years ago, we used to at night have huge numbers of moths that would circulate around looking for bugs. We had bees during the day. A lot of those insects that have gone due to climate and other environmental toxins, and that really affects the productivity of our crops and our ability to have good quality food and water, which we know actually contributes a lot to keeping people healthy. I do want to note that just in my role with the college, that the college has actually done a lot of work over the years in this space, predominantly focusing on climate, not just the public health work, which has been significant, and I know you've contributed there, Tony, but also Dr. Madden with the multi-college work on climate, but other physicians as well, particularly cardiovascular, gastroenterologists, clinical pharmacologists who look at the way we use drugs and make sure we use drugs appropriately and advocate for that too. So I think the college has been out there, but we need to step it up, because I think we don't really have much time. So if I just move on to the next slide, just trying to work out how we do that. There we go. The discussion about climate's really, really important, but I think one of the issues that we also need to focus on is sustainability. So what happens, what is the impact, as Rochelle said, about, if we actually pollute this bit, if we don't use the medications properly, or if we order a test that's not needed, what is actually the impact on that, on the environment, on people's healthcare? And there is a social justice point to this, as Tony's mentioned, because it's easy to pollute in someone else's backyard and technically offset it by growing trees somewhere else. But that's not really a solution that we should be entertaining. For example, the fracking in the Northern Territory and the pollution of some of our most vulnerable populations, yet the heads of INPEX and Santos don't actually live or bring their children up in that environment. So I think this is a global issue, and we do really need to think about sustainability of the whole planet. But in terms of the presentation today, this is on our health service organisations and on health, particularly what do we have to do with climate change. I don't need to go through all of that, we've heard the figures already. These are actually taken from the Australian Commission for Safety and Quality, and we've heard from Dr. Anne Duggan as well, referred to earlier, and I'd like to thank her leadership and Dr. Caroline Hullett, Chief Medical Officer, for getting the colleges to stand together to actually make a unified statement on climate change, and particularly the role of health. There's more work that will be coming out on that pretty soon. I wanted to mention here Evolve. I hope you can see that slide right up in the top corner, and Rochelle's done a huge amount of work in Evolve. Evolve is really looking at low-value care and making sure there's evidence for what we do in clinical practice. And to be honest, there's so much over all of the specialties that it's actually very difficult to know where to start. In clinical pharmacology, we just wanted to say, think about the drugs that you're using and make sure you've got evidence of doing more benefit than harm, but that was a bit sort of broad, so we did have some specific issues around medicines, and I think that that was actually quite an important step. The issue we've had is around implementing that Evolve work, and I think that takes significant resources and it's unclear whether members who fund membership organisation want to pay for the costs of that implementation. So it's really around aligning with government and other organisations that already have runs on the board for implementing changes in health policy. But as noted already, we do waste a lot, particularly drugs and pathology tests. But as has already been highlighted, we've actually had some success, and I can talk here in my leadership role of the state formulary for New South Wales. That was a new process that we set up in New South Wales, and that was really to look at the way we procure our medications and the way we procure our anaesthetic gases. And we, I think, had a significant win with desflurane in New South Wales. We were actually a wee way behind some of the other states, but I think it was we have a lot of anaesthetists and a lot of processes that support desflurane. We've now got our first guidance on nitrous oxide, and you're correct, Rochelle, in that removing it from the manifold is actually really important because of its leakage and the poisoning it does to staff and to the environment. I would just note here that because a lot of people had said, oh, you'll never change behaviour in New South Wales public health system. Well, we have, and so I think that we do actually have to just get on and do it. And amazingly, when people can see what you're actually doing and why we need to do it, you get a lot of support. And particularly this area affects doctors and the way they use carbon emitting tools. We had a lot of support from the medical fraternity, and particularly around the nitrous oxide, which I agree has made some processes much more complicated, but certainly I think helped patients and the environment. I'd also like to call out my own hospital, John Hunter. Who would have thought that a hospital that's had huge amounts of funding from coal and gas over the years, or particularly fossil fuels, would turn around and have a climate policy in its own hospital. And I'm actually quite proud that this was able to be achieved. So there you go. Even when you think it's not possible, it's actually worth doing some work on culture and education to actually see if you can make a contribution in your own organisation. And maybe that will be one of the take-home points from here. This is a bit messy, this slide, but really I just wanted to say that because I'm really focusing today on what we can do, noting that we all know of the harms, but the Commission on Safety and Quality in Healthcare has done a lot. They put out a statement, as I've mentioned, but also in their standards, particularly Standard 3 looks at, it does require actually quality improvement systems that monitor and the safe and sustainable use of the resources we use. So that's one thing, the accreditation of our hospitals, and maybe we could beef that up more. That's up to all of you to think about what we might be able to do there. The Climate and Health Expert Advisory Group I'm about to talk on, and just with a minute at the end, because I know we haven't got that much time, I'd like to talk on something that the business sector is doing called the Taskforce on Nature-Related Financial Disclosures, and that's essentially putting a price on the damage we're doing to nature and ensuring that that's disclosed in our financials for the company, and I think that's quite important to see that sort of leadership there. So if I just talk about the CHIAG, so as I mentioned, this is a climate health advisory group, and essentially it was set up in response to the first national strategy that we have on climate, and it's that was launched at the end of last year with a whole lot of recommendations about health and how we could actually make a real difference here. The issue, as with all reports, rather than them just being filed, is that there was a commitment actually that we would implement the recommendations in this, and I actually was really excited about it because it talked about a One Health policy, which meant that we had to consider implications across the whole of government. And although it did talk about net zero, and a lot of people don't like a net zero because it depends on where you set your baseline, actually did put those figures in there with then a requirement for us to know actually the damage we were doing and making sure that overall we would, that we could actually measure the baseline and our incremental changes there. So there's a significant amount of governance, which might sound boring, but actually it's really important in making these policies because we have to have accountability for this and we need to have leadership and monitoring at the highest levels. So I think CHIAG is very exciting. CHIAG has a number of health practitioners on there, and it does include members of some of the colleges as well, and some key leaders in this space, and I think it's great to have that leadership from the top, and it's great to have proper structure and embedding across the whole of government. So this is what it looks like. You can download it, National Health and Climate Strategy. It's actually pretty good. It's got a lot of recommendations, but it's really an awareness that climate change is worsening. It's really having significant effect on our human health and well-being, and it's causing mental and emotional distress. And we haven't talked about that today, but there is a paper that's come out of the UNSW team led by researchers there at the College of Psychiatry on the mental health burden and suicidality as a result of some of the climate issues that are going on. So, it really is having an effect on our health currently, and it's only going to get worse. The objectives of that strategy, I did just say to Tony that I'd go through it quickly, but please have a look at it. There are 4 big aspects to it: resilience, decarbonisation, international collaboration, which reflects that it's a global issue, we need to work together, and health needs to be considered in every policy. So what actions are we going to do? I think we've already talked a little bit about the research and innovation. We've talked about probably from a negative perspective, but there is potential to actually do research that reduces the risk of negative health impact on climate. And some of your work, Rochelle, and the team that you called out today, I think should be applauded for this, because it's showing that a lot of what we do in health is not actually helping people, and in fact we're causing a lot of harm, but also damage to the environment. We do need workforce leadership and training, collaboration and governance, communication engagement, and I'm sorry to have this at the end because it's actually one of the most important aspects, which is to elevate the leadership, wisdom and knowledge of First Nations people in the response to the health impacts of climate change. But that's the way it was written in the report. But as we've already heard from Tony, First Nations knowledge is really important. I'm on my last slide here, so that hopefully we've still got lots of time for chatting. This is also from the Commission. There are 5 R's to guide good practice. Well, they actually guide this whole agenda around climate and health. And again, reducing volume of waste, improving waste segregation, reusing certain items, recycling, rethinking outdated practices and low-value care, and dedicating time to research. And look, it's difficult, I think, being a clinician and speaking up on these 5 R's. So kudos to people that are out there in the hospital asking these questions, because I know I've been in these positions too, and you don't tend to make a lot of friends because you're certainly questioning why we're doing things. And but we don't have a choice. We absolutely have to decrease the waste and our low-value care. The last point I really want to mention is the Taskforce on nature-related disclosures. And again, you might think this is big business and you can switch off now, but actually I think we need this to help drive leadership and to drive change in our organisations. And certainly this is a financial disclosure that is currently voluntary for companies, and this will affect not-for-profits and charities down the track as well. So we all need to get with it and start measuring some of the harm that we're doing to nature. But if you just click on that on their website, they've actually got a huge amount of help to start everybody off on a set of disclosure recommendations and guidance, so that you can actually be aware of things. And people talked a bit earlier about the digital transformation. I agree. I think that's going to have a significant effect on nature. Just the cooling of all of those, the batteries and everything that's related. I think that's a loss of water, and you can see that some of the organisations that require a lot of computing and a lot of water to go through their organisation. So I think that just have a look at that and consider whether or not you might be able to introduce it to your organisation. I think there's 416 companies that have already signed up to do this voluntarily, so that's just moving at exponential pace. It was led actually with a business and economics perspective, so I think there's even more telling that this damage to our environment is costing health, which has economic impacts. So the recommended disclosures there, again, I'm not going to go through those, but governance, strategy, risk and impact management, metrics and targets. And I think that's a big one, the metrics and targets, because as with health, sometimes it's actually really hard to even know where to start with this stuff, like what metrics do we use and are they consistent and can we measure these over time? So I just summarise here now, and this is actually off the Taskforce. There are 4 nature-related issues that need to be identified, assessed, managed and potentially disclosed to the primary users of general financial reports and other stakeholders. So this is fabulous, isn't it? I mean, it's basically bringing nature and what we're doing into our company financial reports. So we have to consider our dependencies of the organisation on nature, and water, as we've already talked about, is a big one, but obviously there's lots of other impacts, including clean water and high quality food. The impacts on nature that we cause in health, for example, from our hospital or health service organisation, the risk to our organisation, and that should be in our risk framework as well. So what is our risk if our company relies on water and actually water's drying up? Or we've now fracked so much of the Northern Territory that actually we've damaged the table water that feeds areas that don't have natural water. It was only recently I found out that Alice Springs didn't have natural water and really depended on the table water. And what are the opportunities for the organisation that might benefit nature? And I think these are really key things for us as well. So I guess it's called the TNFD. That approach to measurement includes metrics that reflect this. So yeah, please do have a look at that. See whether your hospital or health service organisation can do something like that. But please, yeah, anything little that you can do, any time you can stand up and speak to this, it is actually speaking for your patients and populations as well. And I think you'll find there's a great support, if not just from the Doctors for the Environment, which we've heard mentioned. There are lots and lots of other groups that are doing good work out there. So with that, I'll end and hopefully we'll be able to see each other soon. Thank you.